As all of you know, the number of new local COVID-19 cases has remained low over the last few weeks, and we are making steady progress towards phase 3. But the virus has not been eradicated. We can see that the global COVID-19 cases are still on the rise. Even in Singapore, we still see isolated community cases from time to time. We cannot let up our fight now. The key is to really step up measures that we know are working as we prepare for phase 3. We know that timely COVID-19 testing, when complemented with safe distancing and safe management measures, is a formidable weapon against the pandemic. Testing is therefore a critical enabler and key strategy in our fight against COVID-19. Over the months, we have been enhancing our testing capabilities and extending testing to more community groups. To support a wider range of needs, as we resume more economic and community activities, we will now make COVID-19 testing more accessible. There are currently around 600 general practitioner clinics and private healthcare providers that can provide PCR testing. From 1st December, any company or individual who requires a PCR test will be able to procure such services from these approved providers. This will help those who need to get their pre-departure testing done. They no longer need to seek approval from the Ministry of Health for such tests. As announced last month, we are also conducting pilots on pre-event testing using antigen rapid tests to enable more large-scale and high-risk activities to resume in a safer manner. We have conducted a number of pilots, such as the Singapore International Energy Week and the One Championship Mixed Martial Arts events. We will continue to pilot different workflows in varied settings, such as at more business-to-business events, live performances, as well as spectator sports. And pre-event testing can form part of our defense strategy against COVID-19. Let me talk about vaccines. The world is keenly tracking the development of COVID-19 vaccines with much anticipation. While a COVID-19 vaccine may not be the silver bullet to end the pandemic, it is an important tool in the arsenal of measures against COVID-19. Singapore co-chairs the Friends of COVID-19 Vaccine Global Access, or COVAX facility, to pool risk and resources to gain access to a portfolio of vaccines. Beyond our efforts through the COVAX facility, we have further broadened and diversified our vaccine portfolio directly with a number of pharmaceutical companies. We do this to improve our chances of securing a suitable vaccine for Singapore in view of the expected global demand. Ultimately, the safety of Singaporeans is our top priority. Only vaccines that are assessed to be relatively safe and efficacious will be approved for use in Singapore and offered to the relevant population segments when they become available. Last month, MOH set up an expert committee on COVID-19 vaccination, comprising experts in infectious diseases, immunology, and other relevant fields. The expert committee will closely monitor the vaccine clinical trials data and recommend the vaccination approach for the different segments of our population. We will share more information on the expert committee shortly. The road ahead is still a long one. Vaccines, even when available, will take time to manufacture and distribute to the world. Meanwhile, we must continue to remain cautious and work together as we progress towards phase 3. I'll now ask my DMS to give a quick update on the medical status today. Thank you.
Thank you very much, Minister. As of today, the 10th of November 2020, the Ministry of Health has preliminarily confirmed 2 new cases of locally transmitted COVID-19 infection. Based on our investigation so far, one is in the community and the other resides in the dormitory. In addition, there are 7 imported cases who had all already been placed on a stay-home notice or were isolated upon arrival in Singapore. So in total, there are 9 new cases of COVID-19 infection in Singapore today. The rest of the details will be provided through an update via MOH's press release that will be issued later today.
Good evening. As we enter phase 3, there are two broad areas of risk which we are monitoring very carefully. First, the risk of imported cases coming through our borders, and second, the risk of local community cases flaring up within Singapore. On both fronts, we are taking careful and controlled measures to reopen and to resume activities. So let me dwell firstly on the borders. This is an existential issue for Singapore because of our small size and our need to connect to the world. It's not just for economic activities, but also for our social and community needs, because we must allow families to reunite, and we would also want to facilitate the entry of foreign domestic workers who are taking care of our loved ones. So we have to reopen our borders, but we are doing so safely and with a risk-managed approach comprising multiple lines of safeguards. For example, where there are countries or places with lower risk, we administer a COVID-19 test upon arrival. That's done in lieu of a stay-home notice. Or in some instances, some places, we would require them to serve a 7-day stay-home notice, SHN, at their place of residence. And then there will be a COVID-19 test done at the end of the SHN. These are the first category of countries which we would consider as lower risk. The second category of countries and places would be higher risk, and travelers from these places would have to serve a 14-day SHN at dedicated facilities. In some instances, we would allow them to serve a 14-day SHN at their place of residence, but they have to be the only occupants there. Right? Within that home, they are the only ones there. Then they can serve the SHN at home, and they will then have to also wear an electronic monitoring device to ensure that they comply with the SHN. So from day to day, in these recent days, you will see a few imported cases every day. All of these cases, so up to now, are travelers who are already serving the SHM and are isolated, and therefore there is minimal risk of transmission to the community. We do have allowance for selected groups of travelers for business, official, and work purposes to move from Singapore to travel overseas. The way we manage this category is by strict quotas, and we also require testing before departure and upon arrival. And all of these travelers need to comply with a controlled itinerary. Right? So that's a separate group which we are managing, and so far the risks are well managed. But the rest of the travelers, the bulk of the travelers, in fact, come through the first two categories that I highlighted, either the lower risk places or the higher risk places. And so far, up to now, all of the imported cases we have been on the stay-home notice, isolated from the community, and that's how we are able to minimize the risk of transmission. Now, to further manage the risk, we will have a new requirement, which is to have all inbound, non-citizen, non-resident travelers who are coming from higher risk countries to take a COVID-19 test before departure. This requirement for a pre-departure test will take place from 17 November 2359. Yeah. So those who do not have clearance or do not meet the COVID-19 test will not be allowed to travel. Even if they have cleared the test and they arrive in Singapore, they will still be required to serve the SHN, and they will still be tested again at the end of the SHN. So that's another new requirement we will put in place to ensure that we have stringent safeguards on our borders even as we reopen them. Next, let me turn to the community. Every day we are seeing not so many cases within the local community, sometimes 0, sometimes 1. But we are not taking any chances, as Minister Gan said just now. Each time a case pops up, we move very quickly to identify all the contacts and to ring fence and isolate them. Realistically, we have to expect the number of community cases to increase over time as we reopen our borders and resume more activities. Today, one cryptic case within our community may not have much of a chance to spawn a large cluster. But imagine as we enter phase 3 with a lot more activities within our community, people dining in groups of 8, weddings of larger sizes, places of worship with larger gatherings, events with larger people coming together. With all of these activities in phase 3, the risk of clusters forming will go up. It is inevitable, as we have seen in countries everywhere around the world. So with more activities in phase 3, we must be prepared to expect the number of community cases to go up, perhaps to the low teens, maybe even to the 20s or upwards in the 30s. We have to be mentally prepared for that and be ready to ensure that even if the local cases in the community were to rise, they do not form large clusters that are out of control. The key to doing that is to step up our testing capabilities, which we are doing, and now we are making testing more accessible to everyone, as Minister Gunn has highlighted. We also need to strengthen our contact tracing capabilities through the expansion of Safe Entry and TraceTogether. We've highlighted that, and we are continuing our plan to distribute TraceTogether tokens. And finally, and most importantly, everyone must do their part to keep up with all the safe management measures that are necessary to ensure that we do not allow complacency to set in and then have large clusters forming. Every individual must be responsible and cooperate with all the safe management measures that are in place today. So these are the two broad areas of risk which I've highlighted in our borders, in our community, the different measures that we are putting in place to manage the risk in these two areas. And again, if we all cooperate and do our part, we can move confidently towards phase 3. And even in phase 3, ensure that the reopening of our borders and the resumption of activities do not result in large clusters forming again, because all of us do not want to have to go through another circuit breaker. Thank you.
So now I invite questions from the media.
Thank you, Ministers and DMS. We'll now begin the Q&A segment. Dear members of media, please remember to use the raise hand function on Zoom if you'd like to ask a question, and a reminder to please keep to one question only. If you are called upon, and you will be prompted to unmute yourself, so please do so accordingly. May we have the first question from Timothy Goh from Straits Times.
Thank you, Ministers, DMS. Now, this morning, ST reported that EDP has set aside about $175 million to procure the lunar COV vaccine. How many doses will this get us? Who will be vaccinated and will it be compulsory? And also, which other vaccine companies are we working with, and how much have we committed to them?
Sorry, Timothy, could you please repeat your question? It was a bit unclear. I think there's a bit of background noise as well.
Yeah, I think there's some background noise, so we can't hear clearly.
Apologies, there was a plane earlier. Sorry about that. So this morning, ST reported that EDB has set aside about $175 million to procure the lunar COV vaccine. How many doses will this get us? Who will be vaccinated, and will it be compulsory? And which other vaccine companies are we working with, and how much have we committed to them? Thank you.
I'll ask DMS to elaborate, but generally the purchase of vaccines, there's some commercial confidentiality involved, and some of the contracts are still being negotiated, so we will not be able to share in great detail specifically how many doses for each of the vaccines that we have secured. But generally, I think we are looking at progressively bringing in the vaccines and to be applied to different segments of the population. As I explained during the last press conference, we will, in the application of the vaccine, we will have to take into account several factors. First is to ensure that the vaccine is effective. And the vaccine, depending on the vaccine, some vaccines may be effective for different segments of population. Some may not be effective for children, for example. Some may not be effective for the seniors. So we have to look at the vaccine, whether they are effective generally or which particular segment of population. Secondly, it also got to deal with safety issues. So many of these vaccines are new vaccines, as you know. They have been tested, but they do not yet have a long-term testing yet. We can apply them, being aware of the potential safety issues. As I mentioned in my opening remarks, that we will have to ensure that they are relatively safe and effective before we apply them. Again, the safety issues may also differ from population segments. Let's say, for example, some vaccines may not be suitable for seniors who have comorbidities, multiple morbidities, and therefore we will have to decide which vaccines are suitable for which segment. And we also, and that is one reason why we have set up this expert committee to advise us looking at the data that's available on these vaccines and to decide whether they are safe for us to use and for which particular segment of population and how many doses do we need for that. And even if we were to apply these vaccines, it will also be progressive because it's not possible to vaccinate the whole nation in one go, and because the rest of the world also needs it. So I think that's why we have participated in the COVAX facility to allow us to have early access to the vaccine, and therefore we will look at how we can prioritize them. And as mentioned earlier as well, previously, that the most likely priority is likely to focus first on the healthcare workers who are in the front line, who are likely to be more exposed. So I think they would get the first priority to be vaccinated. And if the vaccines are suitable, then we will consider the more vulnerable groups like the seniors, who are more likely to develop severe diseases as a result of the infection. And therefore, we hope to be able to protect them, but that's provided that the vaccines are suitable for the seniors. So there are multiple factors to be considered, and that is why we are setting up this expert committee to be able to do a comprehensive analysis and assessment and to recommend to the government so that we can respond accordingly. Maybe DMS, you want to add on?
Yes, thank you very much, Minister, and thank you, Timothy, for the question, which I think is a very relevant one. The expert committee that we've formed is looking into several issues in relation to vaccines, as the Minister has mentioned. We're particularly focused on several vaccine candidates that currently are engaged in phase 3 studies, and this is simply because they are already perhaps very close to completion of the phase 3 studies. We hope to be able to get results concerning the effectiveness, efficacy of these vaccine candidates, their safety profile, and how well the public are tolerating these vaccinations. Already, in addition to what you had mentioned, there was also recent media reports reporting some interim favorable results coming out from the Pfizer vaccine. These are, of course, news that is very welcome. It leads us to have some level of cautious optimism that we may see several vaccine candidates pass that the phase 3 studies and then become available for clinical use. But we are still awaiting further information, not just in terms of efficacy, but also its safety profile. And in relation to how vaccination was provided within these phase 3 studies, make judgment in terms of which vaccine candidates are suitable for which types of patients, including whether they are more suitable for the younger or the older or those with chronic medical conditions. So based on these evidence-based considerations and understanding the risk profile of the population in Singapore, our current thinking is not to depend on any single vaccine candidate, but it's very likely that we will develop a portfolio of different vaccines that may therefore be relevant and appropriate for different segments of the population, and this allows us then to have a more holistic strategy for vaccinating that we can put in place. We have yet to work out some of the details, including finalizing the complete list of vaccine candidates that will be within this particular portfolio, and the strategies in which we will provide vaccination. For example, do the vaccines require one single dose? Will they require more than one dose? Will the vaccines provide a long-lasting response, or will they have a more short-acting response such that there may be a requirement for repeated vaccinations later downstream? These are data that we are awaiting from these studies, which will guide the protocols and the strategies that we put in place for vaccination in Singapore. But the work group and the Ministry of Health are working actively to make sure that these vaccine candidates are available. We are engaged, as the Minister has mentioned, in the various international collaborations. The Friends of COVAX program is a very important one to us, and it helps us to ensure that there's access for vaccines to many countries, including our own. But we also continue to be engaged in various discussions with other pharmaceutical companies with a view towards allowing for access to those vaccine candidates which currently still remain in phase 3 trials. Our strategy is not then also to just depend on any particular company and a particular vaccine. We also are promoting local efforts to develop vaccines in the country, and this is the context in which you would have read that particular report that came out describing some funding support that EDB had provided to Acturus and the Duke NUS collaboration to develop a vaccine locally. It is still premature to talk in terms of what its final confirmed efficacy is, and therefore it's also premature for us to talk in terms of the number of doses that have been ordered. But we are hopeful that these studies, these collaborations will yield a suite of vaccine candidates that can provide good results for our population in Singapore. Over the next few weeks, we hope to give you more information explaining to you these vaccine strategies, but also to give you some sense of what we can put in place to provide some protection for our public against COVID-19 infection.
But I should remind ourselves that even with the availability of vaccine, we probably will not be able to vaccinate or do not intend to vaccinate the entire population, depending on the nature of the vaccine. And even if we were to vaccinate the entire population, it will take time to do so. In the meantime, it is important to continue to ensure that our safe distancing measure, our precautionary measures are in place, and we continue to observe personal hygiene and so on. This will help us to reduce the overall infection rate in Singapore. And as the infection rates are lower, we also have to take that into account. Then the urgency to vaccinate everyone will also have to take into account that the current infection rate in Singapore is at a very low level. And therefore, it's important for us to continue to ensure that we observe the safe distancing measure. And it's also important to bear in mind that we still do not have sufficient data as to the sustainability of the immunity that these vaccines may confer. So we will still need to establish the fact to allow us to have confidence that they are going to provide us lasting immunity. Because otherwise, we will continue to have to either revaccinate the population or we have to continue with our safe distancing measures. So I think in the meantime, it's important for us to continue to focus on our safe distancing measures and safe management measures to allow us to sail towards phase 3 in a safe way.
Thank you, Minister and DMS. Can we now have the next question from Sun Kiat from Taobao?
Good evening, Ministers and DMS. Sun Kiat from Taobao here. I've got a question about the reopening of borders. Is there a reason why Macau and Taiwan, both of which have reported zero community cases for quite some time, are put on the same tier of countries as Malaysia, and whether we are looking at having a travel bubble with these two places?
The assessments of risk are dynamic and will constantly evolve. So from time to time, the adjustments will be made as to where these different countries or places are banded, right? So this is where it is now, but we are watching the developments in all these different places very, very closely because the situation is changing by the day. As to whether or not we have plans for more air travel bubbles, specifically with some of the places highlighted, Macau, Taiwan, I would say our general posture is for countries that are safe, low risk of similar incidents as us, we would be very happy to discuss air travel bubbles with them, as we are with Hong Kong now. And it's a matter of continuing the conversation. And if something happens, then if there are developments, we will announce them in due course.
Thank you, Minister. Can we have the next question from Pei Ting from Today?
Hi, Ministers. Can we understand whether there are any updates on when we can enter phase 3? And also just to confirm earlier the mention on Pfizer, we just want to understand whether the ministry will be engaging companies specifically more closely given the findings of all these different clinical trials, and particularly for Pfizer, whether we are in talks with Pfizer on their progress. Thank you.
I'll ask Lawrence to talk about phase 3. With regard to Pfizer, we are in discussion with them. I think that's as much as I can share with you at this moment, because some of the terms are still part of the negotiation and discussion, so I won't be able to reveal too much details. But suffice to say that in addition to the COVAX facility, of which we are a participant, we are also discussing with several pharmaceutical companies who are doing clinical trials. And Pfizer is one of them, and we are in discussion with them. That's all I can share at the moment.
On the timing of phase 3, we said the last time around that it's contingent on all of us doing our part. In particular, we do need to see a higher participation in the TraceTogether program, as well as continued cooperation and compliance with all the prevailing safe distancing measures. So, as I said, if all the stars are aligned previously, we might be able to enter phase 3 before the end of the year. Right? There's still some time before the end of the year. I do not know whether all the stars can be aligned, but we continue to monitor and we will give you updates if so.
Thank you, Ministers. Can we have the next question from Philip from Bloomberg?
My apologies there. Good evening to all of you. There's a bit of news today with Indonesia saying that they will propose that ASEAN adopt a regional corridor at the summit this week. My question is simply, will Singapore support it? Thank you.
Yeah. I've read that same news, but we've not had a lot of details being put out for us to consider what specifically they are. But as I said all along, our overall posture towards doing sort of the opening of our borders is one where we are in principle prepared to consider more opening up, but it has to be done safely and with appropriate safeguards. And so the general approach we have taken, as I highlighted just now, if the country around us, the country that we are bilaterally discussing, if that particular country is safe, similar incidence rate as Singapore, then we can consider them coming, testing in lieu of SHN or a shortened SHN of about 7 days at the place of residence. If the country is of higher risk, then the full 14-day SHN must apply. Most of them would be in the dedicated facilities and hotels, but in some instances, based on risk assessment, we might allow them to stay at home, but subject to the electronic monitoring devices being in place. So that's our overall posture. So even if we are talking about a regional sort of a bubble being in place, these same principles will apply, because within the region, the countries have different incidence rates, different prevalence rates. You cannot apply a single measure to all the countries in the region. We would still look at it country by country and apply these same principles to individual countries.
Thank you, Minister. Can we have the next question from Zhu Ying from Central News Agency?
Hi, Ministers. This is Zhu Ying from Taiwan Central News Agency. I have two questions. The first one is that when will the new border control measures for low-risk countries and regions be effective? And does it apply to all visitors from these areas, no matter what the travel purposes is? Thank you.
The answer is yes, we've already announced these measures. So the only new thing we are announcing, the low-risk countries, Brunei, New Zealand, Vietnam, Australia, mainland China, we've already announced them, right? So it's not new. We're just sort of providing a summary of our overall approach with regard to our border measures. But the new requirement that I've just announced today is the pre-departure test, which we will require for non-citizen, non-resident travelers coming from higher risk countries. Right? So these are not the lower risk countries, but you're coming from a higher risk country. We will require a pre-departure test within 72 hours before your departure.
Thank you, Minister. Up next, we have Sharon C. from BT.
Good evening, Ministers. I have a few questions. First, could you share an update on the take-up rate for TraceTogether app and token and how close we are to the 70% participation target? And also, what's your criteria and consideration for sorting countries into lower and higher risk categories? And also, whether you could give an update on the antigen rapid test pilot that has been conducted at a few events and how this pilot is progressing. Thank you.
On the TraceTogether participation rate, it is still less than 50%. I don't have the specific indicators, but it's still generally, whether it's through the app or the tokens, at this stage, less than 50%. The token distribution is continuing. We have decided to change the way of doing it because there was a surge in demand for tokens. So rather than do it only in a few centers, all in parallel, we do it one center at a time. And so we are continuing that distribution all the way through December. Right? So that continues. But participating in TraceTogether doesn't require a token. You can download the app and you can start using the app. So the apps are available. We are continuing to promote it, and we encourage everyone to start downloading the app. The faster you download the app, the faster we get to a higher participation rate, the better the stars can be aligned. Right? So, consider downloading the app if you haven't, and we would strongly encourage all Singaporeans to do so. How we categorize countries into lower risk and higher risk, we look at the data, we look at indicators, we look at what's happening within that country, the reported cases, the prevalence rate. We look at the country's range of the measures that the countries have put in place to keep the infection under control. So there is some qualitative assessments on top of the reported figures. We also look at objective data based on the incidence in Singapore, right? So it's not just incidence rate in the country that's being reported, but when travelers from that country come to Singapore and they are on SHN, we test them. We also have a sense of the incidence rate of the travelers who come from those countries into Singapore itself. So we have a range of different data that we look at to monitor holistically the situation in different countries. And then, as I said, it's a dynamic process because the situation evolves very rapidly. So we continuously update the classification. So for those who are traveling, I would also strongly encourage you to please refer to the Safe Travel website on ICA. It's safetravel.ica.gov.sg because that's where all the latest updates will be placed. So if you plan to travel somewhere, you think, well, it's okay, when I come back, there is no SHN, so it's okay. Or there's maybe just a 7-day SHN, so it's all right. I plan for 7 days. You have to be prepared for the contingency that the situation may evolve. And by the time you want to come back, it may well be a 14-day SHN at the hotel, which you have to pay for. So that's the reality of traveling in today's COVID environment. There are risks, there are safeguards to be put in place, and you have to take all of these into account.
The antigen rapid test pilots continue and remain in progress. We've in fact performed several pilots involving pre-event testing using these antigen rapid tests. We've used these pilots as a means of validating our processes in terms of how we would organize testing to be done either on-site or done off-site before the event, with certificates issued and then allowing entry into these events for those who have got negative tests with the corresponding certificate. We've also worked through the processes involving small events ranging from weddings, whether in a banquet setting or even a Muslim Malay wedding sort of format, and extending over into the MICE setting and into bigger events as well. Some of these pilots continue at this point in time, and we hope to be able to extend the scale of events for which pre-event testing can be provided using these antigen rapid tests. Separately, we've been also looking at different types of antigen rapid tests, and we hope to expand the armamentarium of such tests that we have available to use in these pre-event test settings once we have completed the evaluation, so that there's a greater degree of choice and a greater capacity that we will have in place to allow more of such testing to take place. We're pleased to note that so far these tests have not yielded positive results, but this is consistent with the current situation we have, where the community prevalence rate in Singapore is very low. But we remain vigilant, and we continue to look out for cases that may arise in the community, and any positive results that we pick up through pre-event testing will still be validated and confirmed using the conventional PCR tests at this time.
Perhaps I should clarify that the purpose of the trials or the pilots is not to see whether it is a positive or negative outcomes, because currently the incidence rate in Singapore is generally low, so we do not actually expect a lot of positive cases to be identified through antigen tests. If there's a positive case, we will test it with, verify it with a PCR test to confirm whether they are indeed positive, or in fact it was a false positive and it's actually a negative case. So we will use PCR tests to verify it. But at the same time, the purpose of the pilot is really to test the process in different settings to allow us to have a better understanding what are the constraints, what are the limitations, whether it can be done smoothly, whether the flow can be controlled properly, the reporting can be done appropriately, accurately. These are the key elements of the trials, and we will continue to do more pilots in different settings in order for us to test out how it can be done successfully on the ground.
Thank you, Ministers and DMS. Dear members of media, just a reminder to keep to one question per person only. Thank you. Next up, we have Rachel Phua from CNA Digital.
Hi. So the release mentions the establishment of the committee to advise on the COVID vaccine. So we just want to know who is on the committee and how will they carry out their assessments of vaccines being developed overseas. And then, the travel arrangements, just kind of curious, how come, with low incidence rates in Taiwan as well, why are there no travel arrangements with them like we have with Hong Kong? Thank you.
That's two questions. Anyway, we'll answer the questions. First, on the committee, we will share with you the details very shortly. I think in a couple of days, we will release the details on the composition and who's leading it. The key is that they will look at the data that's available, made available from the manufacturers, from the pharmaceuticals, study the clinical trial data, and make an assessment, and also look at the document, and look at the evidence. So I think this is the process that the committee will go through in assessing the appropriateness, effectiveness, as well as the safety issues of these vaccines, and make an appropriate recommendation to the government. Maybe as DMS?
Yes, that's right. The composition, we will give you further information soon, but they come from different sectors and different agencies, and also from the healthcare sector, from the healthcare institutions. Some come from academia, some come from the clinical side. And we brought all these people together because they then represent different sectors, all of which have relevance in the discussion on how we should effectively and successfully deliver vaccination to our population. And they bring different domain expertise into the discussions as well. We will be making available to the work group privileged information that we may obtain as a result of our discussions with pharmaceutical companies. These are all subject to confidentiality agreements, and because of this, the members of the work group will also be obliged to respect the confidentiality of the information that's actually provided to them. But suffice it to say that they will be given sufficient information to allow for a detailed review, not just on efficacy, but the safety profile and the suitability of these vaccines to different types of the population. And with that, they would be able to make recommendations to us and the ministry and to the interagency task force on what would be a reasonable, appropriate strategy to put in place for providing vaccination options to the public. So as we release more information about the work group, its mission, its mandate, as well as who would be within the work group, we hope also to start a discussion or presentations to the public in terms of what vaccination is all about, what's the importance and benefits associated with vaccination, and bring across relevant practical information that will allow the public, therefore, to make informed decisions about how to participate in vaccinating to protect themselves from COVID-19. So we look forward to giving more information to you soon.
With regard to the question on Taiwan, there's no doubt that it is considered a lower risk jurisdiction based on our classification. But there are two aspects to what you are asking. First, which is a question I think asked earlier by one of the reporters as well. Is there a need for a 7-day SHN for travelers coming in from Taiwan? And as I said to that question, the answer is, well, we continue to monitor, and at some point, if indeed Taiwan continues to remain low-risk, safe country jurisdiction, then we may very well put it on the same footing as some of the other places like New Zealand, Vietnam, where there is no need for a SHN. As long as you have a test on arrival, then there is no need for a SHN. So that may happen along the way. As I said, it's a dynamic process, and we continue to update. But your second aspect of the question is travel bubble, which is different. That's a bilateral arrangement. A travel bubble means we have to discuss and the other side has to agree. We do not have travel bubbles with all the places which are low risk, right? Because that requires bilateral negotiations and agreement on both sides mutually. So we continue to discuss these possibilities with all these countries, and to the extent that mutual understanding and agreement can be reached, then we can announce a travel bubble when that happens.
Thank you, Ministers and DMS. Can we have the next question from Suranjana from BBC?
Thank you, Ministers. You mentioned the stars aligning for phase 3. Could you give us some more detail on what you're expecting to see, or any targets if in fact you're expecting it to happen before the end of the year?
I did mention just now that we are talking about participation rate or in the TraceTogether program of about 70%, and we've highlighted that as one of the indicators we would look for. We are not there yet, but the TraceTogether token distribution is happening across the entire island, community center by community center. Eventually, we will reach everyone by around mid to end December, right? So I think with that process, just with the tokens alone, participation rates in TraceTogether, I think, will certainly go up. Of course, if people were to download the app, on their own accord without waiting for the tokens to be distributed to them, then certainly participation rate can also go up faster. So our encouragement to all residents in Singapore is to get on the TraceTogether program. You don't have to wait for the token. Download the app on your smartphones, and the higher the participation rate, I think gives us more confidence to get on to phase 3. The second indicator I mentioned, it's not so much a quantitative indicator, but just a sense of overall compliance and cooperation. We do need to see Singaporeans taking today's measures seriously. Because if people are not even, responsible enough to uphold today's measures, then I think going for further relaxation is going to be very, very risky. So we do want to see that through our enforcement efforts, through our safe distancing ambassadors that are on the ground, deployed on the ground, observing what people do at restaurants, at parks. We want to ensure that there is that continued vigilance and cooperation with all prevailing safe management measures. And we seek everyone's cooperation to do this. And if we all do this well, then as I said, it gives us also another indicator, another sort of marker where we then have confidence to enter into phase 3. So those are the two broad areas that we are looking at. The third area which we have highlighted before is testing. But on testing, we are proceeding well. So we have the capabilities, everything is on track. So we do have the testing capabilities already in place. Right? So we just need the contact tracings, TraceTogether to be up. We need compliance with safe management measures to also be up there. And then with all three, indicators that are with all three indicators showing green lights, I suppose we would be in a position to enter phase 3. Exactly when that happens, we keep an open mind. We watch over it very carefully. And as I said, there may be a chance we can do it before the end of the year. If not, we will roll over to January or roll over to sometime early next year. Right? I think it's more important that we do it right than we rush into phase 3 and end up with bad consequences down the road.
Thank you, Minister. For the next question, we have Stefania from FT.
Hello, good evening. I would like to ask whether Sinovac is among the companies you are in discussions with to secure a COVID vaccine. And if you are, is Brazil's decision to interrupt the clinical trial of CoronaVac after an adverse incident making you reconsider the willingness to secure Sinovac's vaccine? And if you are currently not in talks with Sinovac, is CoronaVac no longer an option due to what has happened in Brazil?
Thank you very much for your question. As Minister had mentioned, as I had mentioned as well, we are in fact in discussion with different pharmaceutical companies, all of whom are producing vaccine candidates and engaged in studies. But we are not at liberty right now to mention specific pharmaceutical companies simply because some of these agreements remain in negotiation. For others, we have in fact entered also in confidentiality agreement which limits what we can say. We do need to have their permission before we do announce whether or not we are bringing or procuring any specific vaccines. We are aware of Sinovac's study that was conducted in Brazil, and that more recently that study recruitment had been suspended because of an adverse event. We don't have much details in terms of what the nature of that adverse event is. And similar to two other vaccine candidates both of whom had been involved also in other studies with interim suspension of recruitment being carried out. This suspension of recruitment is a very common activity that occurs in many of these studies because there's a need to study the data that's coming out, to examine the circumstances around which an adverse event occurs, and to determine whether this is related to the use of a vaccine candidate and whether or not it then raises concerns about the safety or efficacy of a particular vaccine. So we don't have enough information to judge whether the current interim suspension of recruitment in Brazil reflects a serious or minor adverse event, and we look forward to more information before we can further evaluate this particular vaccine candidate. It is one of many vaccine candidates engaged in studies right now, and we continue to track many of these vaccine candidates and their progress through the studies.
Thank you, DMS. Can we have the next question from Gek Ling from Shinmin Daily?
Hi, Ministers. It's Gek Ling from Shinmin. I'd like to ask, because the nightlife business industry is going to go on pilot soon, and the ART testing is one of the requirements for the karaokes and nightclubs. But one of the concerns is about the pricing of such testing. So is it possible that, by the end of the year or by January, the cost of such tests can go lower? Because currently the minimum amount that we heard is $30, but they're hoping that, is there any way we can go below 20?
Let me say that we are, in fact, in discussion with laboratories and suppliers to see whether we can fine-tune the pricing. But it also is an issue relating to volume. I would imagine that with more testing being applied, with the volume being driven up, the pricing can probably come down somewhat. But we also have to bear in mind that in addition to the cost of the testing, there's also significant costs involved in the setting up of the testing facility. Let's say, for example, if you have a certain event and you need to set up a station to do the testing, you need to take the necessary precautions, including infection control, this and that, and you also need to employ trained persons who are able to administer the test. All these will add to the cost of administering the test. So the test itself has a certain cost, and we are discussing with the suppliers to see whether we can make it more affordable as time goes on. With the volume, we hope to be able to reduce the overall cost. But there's also an administration cost, the setting up cost of the process, the testing process itself. And this is also part of the pilot that we want to see what kind of a setup will be more economical, will be more efficient, and more cost-effective. So these are part of the subject of the test that we are currently conducting.
Thank you, Minister. We'll now be taking the last 3 questions. Can we have John from Reuters?
Thank you, Ministers and DMS. I just wanted to go back briefly to the question of the Pfizer vaccine. There's been some caution that Pfizer's vaccine requires special cold storage facilities and costly infrastructure to distribute. My question is Singapore well equipped to use this vaccine given these constraints, or would it be inclined to wait for alternatives that would be easier to store and to distribute? Thank you.
Thank you very much for your question, John. I will point out that we have a national adult and child immunization program which involves vaccinating many in the population, including students, those in our schools as well. And we do have some familiarity with the requirement for cold storage, both in storing the vaccines as they're brought into the country, the logistic requirements also for maintaining the cold chain as these vaccines are transported from one place to another. And even at sites where we set up for vaccination, there will be various requirements to ensure that the vaccine is preserved in an optimal state prior to its use as well. And cold storage is therefore one of the issues that we are looking at, and we need to then make sure that we have adequate capacity and capability to do so. It's something that we have some familiarity with. We already do have some cold storage facilities that allow us to be quite familiar with the process of storing vaccines. And as we discuss with the individual pharmaceutical companies about their vaccine candidates, some of the information we request from them are specifically issues in relation to how their vaccine should be stored and maintained before vaccination actually takes place. So we are giving some thought into how these vaccines should be stored and maintained. That includes if necessary, setting up additional cold storage facilities to what we already have in the country, but also giving some thought in terms of how these vaccines will be transported from one place to another. So that's part of the work that the expert committee is looking into.
Thank you, DMS. We will now have the penultimate question from Nicholas Yong from Yahoo.
Hi, Ministers. My question is with regard to the move to make PCR tests more accessible for all. I'm wondering what will be the cost of a PCR test, and with more providers and presumably greater demand, is the cost expected to increase or go down, and will the government subsidize the cost of these tests for those who want to take it?
Just as Minister had mentioned for the antigen rapid test, on a similar basis, we are looking to see whether we can reduce the cost associated with both performing the tests and at the lab end, as well as the infrastructure required for the testing. In fact, the cost of the test already has decreased quite substantially from the first time these tests were made available for diagnosis at the beginning of the COVID pandemic and now. And we continue to work with the various laboratories and service providers to reduce that cost further. We are increasing the access to these tests by decentralizing and allowing more private test providers to make these tests available to members of the public. These tests will not be subsidized, and cost would be paid for by those who seek these tests at these private labs.
We hope that through the making available testing capacity from the private sector, there will be competition and there will be more supplies available, and by doing so, we will ensure that the price they are offered will be competitive, and that will reflect the true cost of the test.
Thank you, Minister and DMS. We'll have the last question from Lee Simin from Wan Pao.
Hi, I would like to ask how many people have taken the antigen rapid test for the pilot so far, and is there a target number to hit?
So, I don't have the actual figure in terms of how many people who have undergone antigen rapid tests at this point in time. So, we'll look to see whether or not any of that information can be made available soon. You had a second question? We don't actually have a target number in terms of the number of tests that we want to perform. It really depends on the pre-event test settings. And as we continue to expand on the pre-event tests, not just in terms of the number of events, but also in terms of the scale, the magnitude of testing will increase and the number of tests performed will continue to rise. We are also working out with the various test companies to bring more of these antigen rapid tests into Singapore. So we hope as we expand the event testing pilots and programs, our capacity will grow in tandem, so that should not be a constraint.
One thing that we did mention earlier is that as we enter phase 3, we might be able to expand the number of people in different settings, weddings, gatherings, events. And in these larger gatherings, one condition we might want to consider is to have a pre-entry test done through an antigen test. Right? So that's something that's on our minds, and that's why we've started with all of these pilots. It's really to give us experience with pre-entry or pre-event testing, help to build up capabilities in order to ensure that it's available, and eventually when we make it a requirement, if and when we make pre-event or pre-entry testing a requirement for certain larger scale activities to happen in phase 3, then indeed the organizers of the event can avail themselves to the antigen testing protocols that are already available in the market at that time.